Carle's Neonatal Intensive Care Unit, or NICU, has a special environment for its special patients. But some tiny patients need a darker and quieter space than the NICU can offer.
It's kind of like what you're sitting in now. I mean, it's very bright. We would be cautious, when you're in your bed space, to be quiet around them and keep it dark, but that's really hard to do when everything around you is loud.
Hopefully that'll make them happy.
Yes.
And what's loud for a typical NICU patient is very different than what's loud for a patient of this size.
Preemies, especially the micro-preemies, struggle with their neurobehavioral development. Everything we do for a reason, and it's just easier to do when we have the right environment.
The right environment is Carle's small baby unit. To compare the two spaces, here's what it looks and sounds like in the NICU on a typical day. Compare that to the small baby unit. The purpose is to mimic what it's like to be in the mother's womb, so these preemies can develop as much as possible.
Long-term outcomes without this can be poor, and we don't always see that for years down the road. And it's heartbreaking to see if we're not doing these interventions, what can happen to these kiddos.
It's another step the Carle NICU takes to give these little ones the best shot at a big future.